Hi, this is Clay Archer, Data Services Lead for this year's Florida Mission of Mercy. The Mission of Mercy is a 100 dental chair charitable dental clinic provided by the Florida Dental Association Foundation. The goals are to relieve pain and dental infection, and restore smiles to treat up to 2,000 patients during the 2-day event. The following is a brief description of your responsibilities for each department. Please follow these instructions carefully. It's important that we collect the data in a specific way. And we also want to route people through the clinic in a very efficient manner. Thank you so much for volunteering and enjoy the rest of the video.
As an overview, on Thursday from 2 to 6 p.m., 300 veterans are going to be pre-screened. They will return on Friday at 5 a.m. for treatment. At 7 p.m. on Thursday, the patient entry gates are open to the general public. Some patients will spend the night waiting for dental care. Parking and crowd control volunteers will guide the patients throughout the 48-hour event. Patients will queue up by ticket number in the pre-dawn hours, and at 5 a.m. Friday and Saturday, they will begin to receive their name tags from patient entry volunteers and folders with Florida Mom forms from the Impact Study volunteers. When the patient entry captain directs, 25 patients at a time will move to the patient education tent. They will then go to the patient waiting tent where they will get their wristbands. In numerical order, patients will be admitted to the patient registration room for data entry. Patient registration volunteers will sign in using the check-in user in the Florida Mom software. The password is FLMOM, all lowercase. Patients will be given paper forms while they are in line. Once the patient arrives at data entry stations, make sure their mandatory Florida Mom form and acknowledgement of privacy practice forms are completed and signed in black ink and black ink only. We're now going to check a patient in. We're going to click No here because this is a new patient and we haven't seen them before. We're going to click Yes because this is the patient or the legal guardian. We're now going to enter the mandatory information on this screen, such as the demographics, contact information, visit information. Again, all of this information is mandatory. At this point, we're going to ask the patient, do you agree to be in the study? And enter yes or no. If they say yes, check page 5 on their informed consent form for the study and make sure they have signed and printed their name and the witness signed and printed their name. Witness, the ICF is also needed, the informed consent form, and place a green sticker on the front of their folder. If they say no, remove the ICF if it is still on the folder and put it in the recycle box. Thank them for considering being in the study and continue on to the next screen. Verbally ask the patients the questions as they appear on your screen and record their answers in the software. Depending on their answers, the program may skip to the next appropriate question. Once the answers are entered and you click Finish, print the clinical treatment form. Write their patient number on the top right of the questionnaire and put the questionnaire in the collection box. Write the patient's clinic number on their wristband and on the front of their chart with a Sharpie pen while the form is printing. The printer assistant will deliver the clinical treatment form, verify their date of birth, and make sure that the patient's wristband number and the clinical treatment form number match before placing the form in the patient's folder. Ask the patient to complete the health history questions on the form while they are in medical triage waiting. A patient ambassador will direct them to medical triage. When the patient leaves registration, they will stop at the scan station where they will have the following forms scanned: the mandatory FLMOM form, the acknowledgement of privacy practices, and page 5 of the Impact Study informed consent, if it has a green sticker. In the scanning software, enter the patient number, patient last name, comma, first name, and then click Save. Routing volunteers will use the assignment desk user in the Florida Mom software. The password is the same as the others, it's lowercase FLMOM. Once in the assignment desk, you'll use the search feature to find the chart number of the patient. Once they're found, click the Assign button and then choose the appropriate treatment area for the patient and then click Assign. Patients who terminate their participation in the Florida Mom Clinic while in the small gym must proceed to routing to be scanned out prior to exiting the building. There's a separate scan station for scan out. Use the patient's chart number, patient last name, and first name when scanning in those charts. Patient exit volunteers will use the checkout user in the Florida Mom software. The password is just like the others, it's lowercase FLMOM. Once in the software, choose the primary treatment area that you are currently manning. When patients come to checkout, it's imperative to review the clinical treatment form to make sure that all procedures are listed and the provider that performed the procedures is also on the clinical treatment form. We're going to head back over to the Florida Mom software. Let's do a quick search by chart number and then click Checkout, making sure that we're in the proper treatment area. We're then going to do a quick pre-checkout survey. Let's make sure we can get as much information here as we can, and then click Next. Then we're going to enter treatment just as it appears on the clinical treatment form. Please note that some treatment will require additional information such as tooth number and surface. Also, we can add as many procedures as is necessary. Also, if we make a mistake on any of them, we can click this little red circle and click OK and remove that procedure. As soon as we're done, we can click Next and then Finish. We're now going to ask if they want to keep their forms and mark their choice on the back right bottom of the clinical treatment form. We're going to scan their clinical treatment form, their mandatory mom form, and the receipt of privacy practices, and the study ICF if they have a green sticker on their folder. You do not need to scan their radiographs. In the scanning software, enter the patient number, patient last name, first name, and then click Save. Return the informed consent form and all other forms the patient would like to keep. Place the forms the patient wants to discard in the recycle box. A patient ambassador will walk the patient to the exit for a patient care bag and comment cards.
We thank you for volunteering for the Florida Mission of Mercy. We know you will share kindness and caring to our guests in need of treatment. Please refer to your patient registration protocol for details. Your team captains will conduct an on-site orientation and will be available to assist you at all times.